Welcome to The Scoop from the Lurie Cancer Center's Adolescent and Young Adult, or AYA Cancer Program. We bring together AYA cancer survivors and experts to answer important AYA cancer-related questions. We hope you enjoy the conversation today.
Good morning, everybody. Welcome to The Scoop. Thank you so much for being here with us today. Today, we're going to talk all about finances and cancer, and we're just going to get started with a few introductions. So my name is Bryn Fowler. I'm the Adolescent and Young Adult Oncology Program Coordinator at the Lurie Cancer Center at both Northwestern Memorial and at Lurie Children's Hospital. Lainey, do you want to go next?
Sure. My name is Lainey Brewster Quinn, and I'm a metastatic melanoma survivor. I'm also co-president of the Patient Advisory Board to the AYA program, which is the Adolescent and Young Adult Cancer Program at Lurie Cancer Center. And that's me. I live in Chicago.
Thank you. And last but not least, Monica.
I am Monica Bryant. I am a cancer rights attorney, co-founder and chief operating officer for a nonprofit called Triage Cancer. So I'm delighted to be here today with you two.
Awesome. We're so happy to have. Yes. If you don't know Triage Cancer, we hope that you can learn a little bit more about Triage Cancer today and check them out because they are just a wealth of information and really wonderful resources. So we hope that everyone finds our conversation today helpful.
So, being a cancer survivor, I know firsthand what it's like to get a cancer diagnosis and how overwhelming it can be. So much information comes your way, treatment options, resources, everybody gives you packets of information, and it's just like you don't know what to do with it. And you're just dizzy with everything. So can you talk a little bit, Monica, about Triage Cancer and not just like what you guys are here for, but also like when you get a diagnosis, like, is that when you come to Triage Cancer, or is it further down the road, or if you have specific issues? So if you want to just talk a little bit about that, that would be great.
Sure. We created Triage Cancer to try to solve exactly the issue that you just talked about. When somebody gets a diagnosis, there's so much information thrown at them, and it can be incredibly overwhelming at a time when you're also dealing with all of the emotional aspects of getting this news. And so what we try to do at Triage Cancer is provide education on as many practical and legal issues that we can to help people figure out what do they need to deal with right now and what can maybe be dealt with later, which is the very definition of triaging. And it's how we got the name.
That's true.
Right?
Yeah, that makes sense.
So some of the issues that we talk about are things like health insurance options and navigating your health insurance and employment rights and estate planning and medical decision making, and finances is a big one that we talk a lot about because all of these practical and legal issues have to be dealt with. And yet most of us are never taught about these issues until we're thrown into a situation where we suddenly have to understand them and be able to navigate them.
And by then you're just underwater.
Exactly. And then with respect to what you were asking in terms of when should somebody come to Triage Cancer, I mean, ideally, we would want someone to be given the information at the moment of diagnosis because there's quite a bit of information that somebody needs before they start making decisions. Like, do I have to quit my job? Or what do I have to tell my employer? Or does my insurance cover this provider? But we know that that's not always the reality, right? So people often don't come to us until later down the line, and that's okay too. So really anywhere along the continuum of care, I believe we have resources and information that can be useful. That being said, the information that we give is actually useful to all of us as we have to navigate a healthcare system. We just talk about it through the lens of cancer.
Mm-hmm. Yeah, that's so true. It's all very complicated. And so I've learned things from Triage Cancer as I've explored it. So that's helpful, Monica. Thank you. So Monica, can you kind of give maybe a little bit of advice to a cancer patient or survivor as they're struggling to manage the financial costs associated with cancer?
Yeah, this financial burden or financial toxicity, I think, has just become a bigger and bigger problem as the treatments have become more advanced and also more expensive, but also as more and more people are being diagnosed at a younger age. And so I think that we have to, as a cancer community, really try to prepare people to deal with this financial burden. And one of the reasons the financial burden is so challenging to deal with is there's multiple contributing factors. It's not just one thing. It's not just about the cost of care. I would argue that the number one culprit of financial toxicity is having either no health insurance or having inadequate health insurance. And that's a real problem, especially, I'm generalizing obviously, but especially in the AYA community. Most of us as young adults don't think we need to have this super robust health insurance policy until we need it. So that's a big thing that we do at Triage Cancer is try to educate people on what are your health insurance options, and then how do you make educated strategic decisions between those options.
Yeah, that's smart. Yeah, in that age group too, it's like I remember, I'm older now, but I remember being that age and thinking, like, I didn't have health insurance for a long time because I was working jobs that didn't provide health insurance because I was really young and starting out. Right. So yeah, that is a big problem.
And prior to 2010, it was more challenging to even get health insurance. In 2010,
totally.
Was passed, or otherwise known as Obamacare. But now we have more options as consumers. So even for people who are working jobs that may not provide health insurance, there are options. And there's even financial assistance to get health insurance. And so we really just want to educate people on what those options are so that they're not in a situation where they think, well, I can't afford insurance or I can't get insurance now that I have a cancer diagnosis. Because oftentimes that's not the case.
Yeah. I was just going to say, the option, when you said that about the options, like I had my initial diagnosis when I was 18 and stage 2 melanoma. But then when I got diagnosed in 2012, if that pre-existing conditions clause hadn't existed, I would not have nobody would have taken me on as for health insurance.
Yeah. And health insurance is only one piece of that financial puzzle. So certainly there's going to be employment changes or ramifications. So if somebody has a job and they have to stop working, what do they do to deal with that loss of income? Or if somebody's trying to work through treatment, what are those options?
Yeah.
And then also all of the things that normally impact somebody's finances, like life changes, keep happening even after a cancer diagnosis. So relationship changes, getting married or getting divorced or moving or graduating from school, all of those things impact your finances and can just compound what people are struggling with once they have a cancer diagnosis.
Yeah, totally.
Yeah, that's so true. And there are so many other wonderful organizations, Triage Cancer being one of them, that help people to navigate this or provide resources with co-payment assistance. And we do our best to try to collate some of that information for AYAs and resources like our monthly newsletter. So if you aren't receiving those, I would encourage you to sign up. But Monica, are there go-to places within Triage Cancer? Is it your website or reaching out to someone if someone had more questions, maybe specifically about health insurance?
So I think there's two main places I would ask people to start or suggest that people start. Certainly our website, which is triagecancer.org. Everything that we provide is free of charge. And we have a variety of resources because we recognize that people don't always learn in the same way. So we host live events, monthly webinars. Pre-COVID, we were doing in-person conferences. We've switched all of that over to virtual, obviously, for this year. But then we also have handouts that we call our quick guides and checklists. And they're, 1 to 2 page documents on a particular topic. So for example, I'm losing my job or I have to leave my job for treatment. What are my health insurance options? We have a quick guide on that. You can just go to our website, download it, print it off. We also have animated videos. And these are anywhere from 4 to 6 minutes, and they cover some of the most important topics, like picking a health insurance plan or dealing with side effects at work, or how to access a clinical trial. And so they're available in English and Spanish, and then all of them also have Tagalog subtitles. So we're trying to reach people in as many, languages and formats as possible. And then finally, we have an entirely separate website called cancerfinances.org. And this website has information about a lot of the topics we've already talked about today, but then even more, including things like education rights and specific information around COVID and health insurance and work. But what's unique about cancerfinances.org is that it's set up in a sort of choose your own adventure format. So the website will pose questions, and then based on how the user answers those questions, it will take them to targeted information. And we did that to try to address what you were talking about, Lainey, that overwhelming, dizzying, too much information. What do I need to know? Yeah. Cancer Finances is our attempt to try to sort of reduce the clutter and send people to just the information that they need at that time.
Yeah, that's awesome.
That's really great.
So I have a question that actually I struggled with. 5 years ago, I had purchased insurance, and 8 months into the year, I was unenrolled back to my effective date. Completely illegally. They had no basis to unenroll me. They came up with different excuses, etc. But they mainly, nothing was true though. They said things like I didn't pay my premiums, but of course I had records for that. And ultimately, I just didn't know how to represent myself and what all of my rights were. I mean, I did my complete due diligence. I filed appeals, went straight to the Department of Insurance and the local Attorney General's office and everything. And in the end, the Department of Insurance favored the insurance company, even though they brought no proof to the table, and I had all of my proof laid out. But I didn't know what to do with that. I didn't know where to go to I wanted to talk to a lawyer or get some legal advice. And I know you are a lawyer, right? And you guys have a legal advisory council. And I'm curious, is that something like if I had an issue and I was like, what are my rights here? Like, what's going on? Is that something I could talk to you guys about and get a little bit of counseling there? Or how does that work?
Yeah. So as an organization, we don't provide legal representation. And the reason for that is that we believe that providing the education and the information in a majority of situations is going to solve the problem, and solve the problem in a way that helps the individual who's coping with cancer meet their goals. So for example, sometimes someone wants to stay at work. So hiring an attorney might be contradictory to that goal. Certainly in your situation, from what you've said, it does sound like sitting down with a lawyer may have been, useful or appropriate. And in those situations, we do have some resources to help point people in the right direction of how to find an appropriate lawyer. But ultimately, what we're hoping is that people can avoid legal action whenever possible to meet their ultimate goals. But certainly that sounds like an egregious case, and I'm so sorry.
I know. But ultimately, I was very lucky because I had a lot of support, and I was able to prove to other insurance companies that I really did have insurance for the past 8 months. And so after proving to them, they took my word for it, and I was able to get insurance for the rest of the year. So things went well. But it's if I was, not my tenacious self, or I had a lot of other obligations on me, I had been lucky from the situation. So it'd be nice so that somebody could come to you guys and you just point them in the right direction.
And I was just going to say, I love that focus of really educating people and giving them the autonomy to be able to do some of those things for themselves. So let's think a little bit about a workplace. Do you have any suggestions for someone of how to talk to their workplace, or maybe what rights they have after they receive a cancer diagnosis?
Sure. I mean, I think the number one thing I tell people at the get-go is to recognize that you have rights and decisions around disclosing your cancer diagnosis at work. So a lot of times people don't recognize that they have some options around, are they going to tell their employer or potential employer if they're searching for a job about their cancer diagnosis? And for some people, it's a no-brainer. They are shout it from the rooftops. Of course, I would tell everybody, why wouldn't I? Some people feel very differently and maybe want to keep that piece out of the workplace, or they just don't feel comfortable talking about their health, or plethora of reasons, right? And so what we really just want to empower people to know is that if they want to keep that information private, generally speaking, they can. There's a couple of times they might have to disclose some information about their medical condition, but maybe not specific. For some people, really, and about when so much is taken away from somebody, this is a piece where they can regain some control in making those educated, conscious, deliberate decisions.
Yeah.
The other thing I would say, sort of past that disclosure piece, is to really think through what are the goals. So we often find that individuals are up against a lot of assumptions. So assumptions from an employer of, well, how could you possibly work? You have cancer. Assumptions of their own of, how could I possibly work through treatment? And then we get a lot of assumptions from healthcare providers of, you don't just go out on disability while you're dealing with treatment and like worry about work later. But the reality is there's a lot of reasons why somebody may need to stay at work or want to stay at work. And so depending on where somebody is, we just want them to know that there are lots of options to continue working through treatment or to return to work after treatment, even if you're dealing with side effects, either long-term or late-term. And of course, it's not one size fits all. It's going to be very situationally specific. But again, it's that empowerment and choice piece. If you have all of the information about what your options might be, then you can make the right decision for you.
Yeah.
That's great.
That's really helpful. Thank you.
Yes, so helpful. What do you want to get like when employers have to work with you and your sort of disability like benefits? I know that they have to, like most states legally have to like work with you and your disabilities too, so long as it doesn't kind of impact their ability to do the job at all. But you do have to disclose your situation, or do you not have to? Like, what's the situation there?
Yeah. So under the Americans with Disabilities Act, which is the federal Fair Employment,
that's what I was like,
federal Fair Employment, employers of a certain size are required to provide eligible employees with something called a reasonable accommodation. And a reasonable accommodation is, it can be very flexible, and it's probably one of the most important tools for somebody who's either working through treatment or, returning to work, because it can be super flexible. So it could be about furniture or days off or a flexible schedule or using technology. In addition to the federal law, there's also state fair employment laws, many of which cover smaller employers. And all of this information and the details are included in those quick guides, in those animated videos, and on our charts of state laws. So I know most people watching are probably going to be from Illinois, but if you're out of state, that information is all included on the Triage Cancer website.
Wonderful.
That's awesome. So what if somebody is diagnosed with cancer but they can't afford health insurance, or they don't already have insurance?
So if they don't already have health insurance, then we'd really need to look at what their options are. And depending on somebody's household size and income level, they may be eligible for Medicaid, which is a government-sponsored health insurance program for individuals with lower incomes. Now, prior to the Affordable Care Act, it was quite challenging for some people to get access to Medicaid. But in Illinois, under the Affordable Care Act, that program has been expanded, and it's made it a little bit easier for someone to access that program. So that would be sort of step one if we were talking about right now, it's September, diagnosis, no health insurance.
Yeah.
But the other thing I just want to remind people is that there is an open enrollment every single year into the marketplaces. And what's being sold in the marketplaces is private health insurance. So the Humanas and Blue Cross Blue Shields and Aetnas, all of those private companies are selling their policies through the marketplace. But one of the advantages to purchasing through the marketplace is there may be financial assistance to help you buy the plan. So depending on your household size and income level, you may actually get help. And there is a huge number of people who could get a bronze plan in the marketplace for free.
Oh, wow.
So yes, there's still going to be some out-of-pocket costs, but that's when we can go to those organizations that are providing things like copay assistance. But the copay assistance is not useful if you don't have a health insurance policy. So step one is to get people the health insurance policy. And we have those options every single year. And we're about to enter open enrollment for 2021. So if someone is sitting here watching this thinking, well, I don't have health insurance now, or my plan isn't that great, I really encourage you to go look in the marketplace, and you would go to healthcare.gov to start that process and look at what your options are. And if you have no clue on how to go about doing that, please take a look at our animated video on how to pick a plan and on health insurance basics, because we walk through the terms and what they mean, and then how you actually pick a plan if you have more than one option. Because again, when we're talking about that financial burden, step one is get the health insurance plan.
Right. Yeah. That's really
great
helpful.
that It's great that you walk through all those terms, because I remember, at the start now I feel like I'm an expert because I've been through so much. But, at the start, I'm just like, I don't know, what is it? What am I going to have to pay? Like, that's what I need to know. Like, what do I pay?
You had to learn on the job, so to speak, right? Like you had to learn it. You had to go through, and that is hard to do. We often joke at Triage Cancer that there should be a class in high school on health insurance and finances.
Absolutely.
Completely.
We all need to deal with this. And where do we learn that information? We typically don't learn it until there's a crisis, and now we're navigating
you have to.
deductibles and out-of-pocket maximums, and it's a lot. So if anyone is watching thinking, wow, I don't understand these terms, what are these ladies talking about? You are not alone. There have been so many surveys done and research studies done to show how few Americans actually understand the words that are being used in their health insurance policy. It's like learning another language. And so
it is.
I've broken all of that down to the simplest terms possible in these resources. So please know that there are places where you can go to get educated, and you're not alone.
That's so helpful. So let's think back. You were talking about, ideally someone is introduced to Triage Cancer, small organization, at that time of first diagnosis. But if we think beyond the introduction to your organization to what is that information that would be most important to think about right after a diagnosis, can you speak a little bit to that time period and what people should focus on?
Yeah, I think it's really about doing a big picture assessment of what resources do I have? What decisions do I need to make right now? So when I talk about resources, I'm talking about things like health insurance policies and what does your employer look like? So is your employer big enough for you to be able to access family and medical leave, so job protected leave? If you're going to access FMLA, do you have disability insurance to help sort of supplement that loss of income? I'd also really think about the medical decision making and estate planning piece. And that is challenging. I fully recognize it is really hard to think about issues of mortality and being in a place where you can't make your own medical decisions. So the way that I try to look at it for myself, and I've gotten feedback that it's helpful for others, is that it's again a place to maintain some control. So by creating an estate plan, I am controlling what's going to happen if I'm not there to make those decisions. And it's actually, I think, a very loving thing to do as well, because you're not then placing that burden on your loved ones when they might be in a challenging place. And so, I say all of this recognizing it's an easier said than done situation, but I think it's really important. And even if somebody's under the age of 18 and maybe can't legally create an estate plan, it might still be really helpful to sort of think through and write down your wishes and, how you feel about certain things and share that with the people around you. Because ultimately, most people want to do what their loved ones would wish. And so, again, I recognize it's not easy. And if you're sort of starting out thinking about the estate planning pieces, again, we have some resources that kind of walk you through all of the different options.
That's good. I do like that way to frame it, though, of maintaining that control.
You never know what's going to happen, right? Like we could walk across the street and get hit by a car. You just never know. And so it really is about being prepared. And I think that if someone is watching and sort of thinking about this and kind of struggling, I would definitely recommend reaching out to a social worker or another mental health care professional. Like they are trained and are able to provide sort of guidance and help through the emotional aspects of all of it as well. And then certainly depending on how complicated your estate is, because I know AYA sort of runs a wide gamut, you may or may not need an attorney. So a lot of times people can write a simple will or a simple advanced healthcare directive without an attorney at all, and it doesn't cost anything.
Oh, that's good to know.
Well, Monica, this has been such helpful information. Can you talk just kind of in wrapping things up if there's any last tidbits you want people to know, or if you guys have any events or other resources coming up that people could take advantage of?
Yeah, so we have a couple of virtual events coming up so you can learn from the comfort of your own home that we're all sick of being in at this point, right? We have 2 of our conferences. Now, these are all-day events, and anybody is welcome. So individuals who have been diagnosed, if you're out of treatment, caregivers, healthcare professionals, advocates, really anyone who wants to learn about this information is more than welcome. It's an all-day event, totally free to attend. We just ask that you register on our website. And we're hosting one on October 3rd and then another one on November 14th. So you can come, the same event, just 2 different days. And we provide CEs for nurses and social workers as well. And then we've talked a lot about health insurance today, and open enrollment is coming up. And so on October 20th, we're hosting a webinar on health insurance options and how to pick a plan. And that's just a 1-hour webinar, again, totally free. You just have to sign up on our website at triagecancer.org. But if you have questions about anything we've talked about today, those are 2 great places to go. And they're live, and we take questions and answer as many as we can. But I really think my sort of final thought that I'd love to leave everybody with is this idea that you're really not alone. And I know you might hear that a lot, but everything that we do at Triage Cancer is designed to try to help people feel empowered and educated. And so if you can't find something on our website or you still have questions, you can always reach out to us. We are very easy to find online.
Oh,
That's really helpful.
Yeah.
Well, thank you so much, Monica and Lainey, both of you, for joining us today on The Scoop. It's been really helpful to talk about all things related to cancer, finances, health insurance, employment. There's so much more that we could talk about. We could have several episodes just on all this. So just a quick dive into all of this. But I really appreciate both of your time and your willingness to be a part of this. Thank you.
Thank you guys both so much.
Thanks for having us.
Thank you so much for joining us today on The Scoop. We hope you enjoyed our conversation and learned something new. If you want to hear more of these in the future, make sure you like our page at Lurie AYA. We hope you have a happy day.